morning, everyone. I'm Ginny Wise, Tulane Senior Vice President for Advancement, and I'm thrilled that you're all joining us for this week's plug-in event. These webinars have been such a nice way to keep Tulaneans far and wide connected to the university and to provide access to our fabulous and fascinating faculty. Just a bit of housekeeping before we get started. We are using Zoom's webinar platform today, which means that all viewers are muted. However, we do want to hear from you. So please enter any questions you might have in Zoom's chat function. I'll be moderating the Q&A after the presentation, and we'll try to get as many questions answered as possible. Now it is my pleasure to turn the virtual microphone over to David Meyer, Dean of Tulane Law School. Go ahead, Dave.
Great, thanks so much, Jenny. And thank you to everyone for joining us. I hope you all are well. I'm happy to report that the law school is doing well also. We're just finished final exams last week, so that's another, of course, all remotely, so it's another milestone in our ongoing and unexpected experiment, but one that has really been both challenging but also really gratifying. Of course, just intensely proud of Tulane and both the university and the law school and our faculty and students and the way that our community has rallied to the circumstances. It's been, of course, I know we're all enormously proud of Tulane's medical doctors and scientists and public health experts and the important role that they have played in combating the pandemic. But of course, the pandemic has important social dimensions as well. And I'm very proud of the way that the law school's faculty and students and staff and alumni have all really stepped up to do their parts in helping to be constructive in attacking this national crisis. I just thought I'd mention a couple of ways quickly in which our students and faculty have been involved, just to give you a sense of the range of contributions. Our students, as an example, have been involved giving pro bono representation to New Orleans musicians and artists who have been upended by the pandemic in terms of the work that they do in the local creative community. Our clinics, of course, have been very active representing vulnerable clients who are facing challenges relating to the pandemic, whether in jails or in immigration detention or in the job market and in communities hard hit by the virus. I'm very proud that one of our 2020 graduates, who will graduate on Saturday, has just been hired into a one-year public interest fellowship, the Lutz Public Interest Fellowship, where she'll be dedicating the entire year to representing families who are facing challenges relating to housing or eviction or other intense challenges relating to COVID-19. And then finally, our faculty have been really involved lending their expertise on a range of topics, everything from constitutional federalism and states' rights in managing the response to addressing the obligations, the legal obligations of cruise lines, to addressing the future of collegiate and professional sports. So for me, despite the challenges, this experience has really been the most powerful affirmation of the sense of our community and our mission. With that, it's really now my great pleasure to introduce Kristin Johnson, one of those faculty stars who has really stepped up during this time. I'm very proud that the law school won genuinely a national competition for Kristin's talents in 2018 to lure her to Tulane to join our faculty as the McGlinchey Stafford Professor of Law from Seton Hall Law School, where she had established herself as a leading national scholar on corporate law and the regulation of financial markets. She's made a name for herself nationally and beyond for addressing topics really at the cutting edge of the markets, things like the recognition, role, and regulation of technology and digital currency and assets. But for the past couple of years, she's really emerged as one of the most prominent thought leaders on the implications of artificial intelligence as that is being increasingly used in many different dimensions, from addressing the social implications of that for use in credit risk assessments and lending decisions to criminal sentencing. Lately, she has been dedicating her insights to the expanding role of artificial intelligence in combating the pandemic, including in connection with contact tracing. As our Gordon Gamm Faculty Scholar, Kristin last year brought and organized a major national conference here at Tulane addressing these topics. So I really am so honored and privileged to introduce my friend and colleague, Kristin Johnson. Kristin.
Oh, thank you so much, Dean Meyer. That was such a wonderful and warm introduction. I hope that I can deliver some discussion points that live up to that suggestion. I feel very privileged to be a part of the Tulane Law School faculty. I recognize that a number of my colleagues on the law school faculty, and in fact, a number of faculty across our campus, are expert in a number of these issues and easily could occupy the space and offer richer and deeper insights into some of the areas that I am learning about myself. What I'd like to highlight, as Dean Meyer has described, is the research agenda I've been working on for the last 18 to 24 months that focuses on the implications of artificial intelligence, or an assemblage of technologies, we could say, that constitutes what we would describe as the body of artificial intelligence technologies and the implications of those technologies in different areas of our society. In recent months, computer scientists, technologists, epidemiologists, and others have joined a race to develop an application programming interface, or an API, that will enable public health officials to trace and hopefully stem the spread of the COVID-19 pandemic. In my presentation today, I will briefly describe a few of the strategies deployed by public health officials and policymakers to slow the spread of the novel coronavirus. I will then share some reflections about the use of tracing as a strategy that is used among several strategies in this context by public health officials. The others will include testing and isolation. So testing, tracing, and supported isolation will be the general focal point, no doubt, for a number of discussions in this area for a long time to come. In my limited time today, however, I will focus our discussion on one specific strategy that is of tremendous interest, and that's largely because of the significance of integrating artificial intelligence into the use of that strategy. So I will focus on the internationally celebrated, widely debated technology of artificial intelligence and the promise for that technology to enable public health officials to expeditiously identify and isolate or quarantine affected people. We'll discuss two specific pathways for integrating artificial intelligence in public health campaigns: Bluetooth token technologies, as well as GPS tracking technology. We'll then discuss the promise and limitations of these two forms of tracing or tracking technology and juxtapose the proposals for integrating contact tracing technologies in different countries. There are a number of concerns that have emerged in the context of integrating contact tracing technologies, and among them we can focus on two specific areas of concern in the final moments of this presentation: privacy concerns and social justice concerns. We'll also discuss private businesses as well as public-private partnerships that aim to address some of these concerns. We'll close our discussion with a few reflections on federal regulatory interventions and a federal congressional bill designed to promote public health while protecting citizens' privacy. I'll leave some time at the end of this presentation for your questions and some discussion, which I hope will be inspiring and motivating for many of us who are coming to this talk from different areas or disciplines, including law, sciences. I know there are ethicists among us that I've chatted with in preparing for this presentation. So coming from an interdisciplinary perspective, what type of campaign might we mount as a nation to defeat COVID-19? Next slide, please. The strategies that have been developed for stemming the spread of COVID-19 are numerous. They include, as the slide before you describes, among the litany of suggestions, a variety of approaches that are intended to stem the spread of COVID-19. Over the last several months, the citizens in our local community here in New Orleans, throughout our nation in areas like Washington, New York, New Jersey, and Michigan, among others, have suffered tremendous loss of human life and an unimaginable impact on institutions such as our economy, costing trillions of dollars and comparable to periods as devastating as World War II and the Great Depression. In response to the rapid spread of the novel coronavirus, public and private institutions have advocated for aggressive strategies to mitigate the impact of the pandemic. We closed our local schools, we closed our universities, businesses, and courts, and other institutions that are a critical part of our national infrastructure. After weeks of remaining in our homes and practicing social distancing, our focus has now turned to the strategies that will enable us to safely reopen the vital social and economic centers. I present to you sort of a group of among the many proposed strategies for accomplishing that goal. In outlining the roadmap to pandemic resilience, scientists and public health officials have pointed out a variety of long adopted strategies or approaches, including testing, tracing, and supported isolation. These approaches call for massive investment in public health and infrastructure. More specifically, they require us to develop diagnostic and serological testing, effective contact tracing and warning programs, and supported isolation or quarantine for those who are identified as having tested COVID-19 positive or having been in close contact for a reasonable period with someone who has tested positive. We could describe these strategies very colloquially as the hammer and the dance, right? The hammer is our massive local and national efforts to stem the swelling tide of COVID-19, which might have included our stay-at-home orders, the social distancing, and a variety of other approaches that we took in the initial phase of responding to the pandemic. The dance is what comes next. And this dance is quite delicate and requires flexible adaptivity, agility, and real-time responsiveness to information that we're learning about the pandemic and about the virus. The most sort of central element of the next phase is certainly going to be testing. Diagnostic tests that would be used for those who are symptomatic and to ensure that those who've had exposure and might possibly test as positive are identified, whether they're symptomatic or asymptomatic, and the extent to which we adopt the tool of testing will largely depend in part on resources expended to that end. So experts advocate that universal testing is necessary, if not ought to be required, and they suggest that we need to deliver 5 million tests per day to safely reopen society and to be prepared for that number to increase to as many as 20 million tests to fully remobilize the economy. These tests include PCR tests as well as the serological tests that I mentioned earlier to identify those who are COVID positive, as well as to identify the presence of antibodies in those who are survivors of the virus. So at this point, I highlight that testing, though it is a central element, is not the only critical element to being successful in fighting the pandemic. This war will require a variety of tools to be accessed from the toolkit of public health workers and public policy makers. And the focal point for my talk will sort of be this next tool that really is an interesting one. tracing. So the tool of tracing, next slide please, is a tool that public health officials have used in a variety of contexts throughout history in a variety of ways. Most recently in history, those who are unfamiliar with tracing might be reminded of the use of tracing in the context of Ebola, the SARS outbreak in 2003. It has been used historically, though, for tracing illnesses such as measles, as well as sexually transmitted diseases. So what exactly is contact tracing? How does it work in its original in its original conception? The original conception of contact tracing, how would that have worked? Well, contact tracing is a technique that public health workers use to identify carriers of an infectious disease and then uncover who else they may have been exposed or may have been exposed to or may have been exposed as a result of the person testing positive. In an effort to isolate those who are at risk and halt the illness's spread, contact tracing has served as a time-tested investigation methodology. It's been used to successfully fight outbreaks of diseases in a variety of contexts, as I described earlier. Contact tracing is a well-established public health intervention, and it is something that has served as a cornerstone in preventative medicine for many years. The challenge today is that the spread of this virus is occurring at a pace that is much faster and much more extensive in many instances than illnesses or viruses that have been identified and for which tracing may have been used in the past. Our goal now is to control the spread of the virus, and tracing, while typically may have been efficient through the use of humans using manual contact tracing practices, which would involve individual public health workers identifying and speaking with targeted persons or targeted communities. In our current, in the current sort of society in which we operate, there are much faster mechanisms to achieve those goals. Next slide. So rather than simply wait for public health officials to physically mobilize and confirm cases and isolate the individuals who tested positive, and then to work through the network of persons that a positive, COVID positive person might have interacted with, we can deploy a technology that would enable us to accomplish these goals much faster. We could deploy a technology that would enable us to ascertain the many individuals who may have been in close proximity with someone who has tested COVID-19 positive in a much more rapid fashion, utilizing artificial intelligence. Next slide, please. With a virus like COVID-19, which spreads possibly through the air, things can get complicated quickly. Contact tracers might end up trying to find those who sat near an infected individual on a plane or a bus, for instance. And even if the sick person is someone they may not have directly interacted with, but was in proximity to the person we're concerned about having been exposed to infection, this is a radically different task from tracing, let's say, a sexually transmitted disease like HIV, which tends to involve a much shorter, more well-defined list of contacts. Investigators in the context of COVID-19 or human tracers who are engaged in the practice of attempting to identify those who are positive and then those who've been exposed face a number of additional hurdles. First, because COVID can be transmitted before people have symptoms, in other words, while someone is asymptomatic, in order to prevent onward transmission from exposed contacts, the contacts must be identified and quarantined in a rather rapid fashion. Right? So second, there is no proven or effective treatment for COVID-19. So unlike diseases for which we may have identified effective vaccines or for which there may be proven treatments, cooperation is complicated, right? With respect to the willingness of contacts to make themselves visible to public health officials, and also the willingness of individuals in some instances to even get tested at this point, right? So the third concern that really is maybe more unique to COVID-19 than some of the other instances in which we've deployed manual tracing is the size of the outbreak, right? So the outbreaks have been so large and so quick that even if we get some contact tracing going on the ground, if we miss a significant case or we miss some smaller cases, contact tracing effort could be undermined, right? So we need now a contact tracing effort that has an unprecedented scale, that is able to effectively address this historically unparalleled series of events, right? So at this point, we ask what type of technology might be able to assist public health officials in their efforts to execute contact tracing, right? So what type of technology might be useful to assist public health officials in their efforts to execute contact tracing policies and practices? So now, before turning specifically to the integration of AI into contact tracing or the creation of a contact tracing app, I'd like to just spend a moment describing artificial intelligence. And that's largely because I think most of the audience would be immediately familiar, and some are intimately familiar or even much more expert than myself in the context of creating and deploying artificial intelligence platforms. However, for the purposes of ensuring that we all arrive at the conclusion of the discussion with a reasonable level of comfort with the topic itself, I think it might be worth just describing what artificial intelligence is and why it might be helpful in this context. At its core, artificial intelligence is probably describable as a branch of computer science or an arm of computer science that aims to replicate or simulate human intelligence in machines. The expansive goal of artificial intelligence is to give rise to the use of machines for purposes or automating activities that we have historically executed manually. Right? So I said at the outset of the talk that artificial intelligence is an assemblage of technologies. It includes a variety of types of technologies that simulate human intelligence in machines. The machines are programmed to think like humans and mimic human reactions. In some contexts, the machines are trained to execute rote tasks, but in most, and we'll talk about this in just a second, the goal of the algorithm is to learn to replicate human thinking and execute human thinking without direction, right? So to simulate the kinds of logic patterns that humans would naturally execute in their own brains. The term has been applied to many different technologies, and the different technologies share at least one single thread of similarity. Human mind is learning, the machines are learning to execute and do what the human mind might do. In other words, to learn and to problem solve. So how might we describe this in broad terms? The machines that are executing artificial intelligence think humanly, they think rationally, they act humanly, they act rationally. So what are some examples of artificial intelligence in our everyday life, or the integration of artificial intelligence in our everyday life? There are predictive capabilities in a variety of technologies that you are certainly using even in this moment, right? So for the most novice and unfamiliar, Netflix is a platform that engages a predictive technology to identify the movies or television shows that you might want to watch. Retail platforms like Amazon or Walmart or Target use predictive technologies to signal to you and suggest to you items that you might want to purchase or order. The use of these predictive technologies has proven a tremendous boon in many areas and many markets. It's also raised a number of causes for concern. And in a moment, I'll talk a little bit about those causes for concern and the limitations of artificial intelligence. For now, what might be useful is to point to the one most widely adopted and possibly most powerful adaptations of this technology, your smartphone. Some of you joining in this presentation today are in fact using the Zoom platform on your smartphone device. You have an Apple iPhone or an Android phone, and you've dialed up into this talk today? Well, as easily as you dialed into this talk today or downloaded the Zoom app for purposes of joining us, you might also later at some stage, quite soon I imagine, be invited to download an app that would enable contact tracers to help you determine whether you have been exposed to someone who is COVID-19 positive, or whether you, after having been diagnosed as positive, may have exposed other persons. Let's talk a little bit ahead of exploring the app and how the app might work about the technology itself. I promised you at the outset of the talk that I would describe two pathways, two technologies that are proving useful for those attempting to adapt artificial intelligence into a form or an app that might be used to facilitate contact tracing. The two technologies are Bluetooth technology and GPS tracking technology. As of the moment, most in the US are describing these possible apps or this technology as an opt-in platform, a mechanism whereby individuals can opt in to permit peer-to-peer warnings to supplement manual contact tracing programs. In other words, the peer-to-peer platform that exists through the Apple device or the Android device and the apps downloaded to various devices, those various devices would enable us to share with one another the extent to which we have tested positive or have been exposed to the virus. When an app user tests positive for the virus and the medical record officer at the testing agency reports that to an app, all app users who have recently traveled through the same spaces as the COVID-19 positive individual would receive an alert on their phone and a recommendation that they should be tested. Those who receive positive tests are connected to treatment and or advised to isolate with social support in place to incentivize them to do so. So that's the notion, right, behind the COVID-19 opt-in contact tracing app. But what does it look like? Well, let's start with the GPS framework as a point of departure, because it's probably the one with which you're most familiar. GPS tracking is relatively intuitive, right? So yesterday in an article published in the Wall Street Journal, a journalist described what the GPS tracking app, that is a COVID-19 contact tracing app, Care19, how that app might have functioned. So the app has been developed for residents in North and South Dakota, and the app basically tracks the user, right? So at 10:28 a.m., she went to Walgreens on Central Avenue. At 11:18 a.m., she went to Claire's, says the GPS tracking app. Claire's is a retail store on East Broad Street. At 12:20, she went to Mavis Discount Tire on South Avenue. And then at 12:49, she went to Magnolia Tire Service on Magnolia Avenue. Well, the GPS tracking app, like much that relates to artificial intelligence, is exceptionally accurate, right? It tracks everywhere that the user has gone, but the degree of accuracy varies. It's true that this time-stamped log of the journalist's movements illustrates her thrilling Saturday morning and likely a repair of a tire, something those of us in New Orleans are quite familiar with. The dilemma, however, is that the app failed to recognize that she hadn't gone inside the Claire's store, but she had merely pulled over by that store for purposes of determining where the next stop in her agenda might be. In other words, there are limitations to the intelligence of artificial intelligence. How might a GPS tracking app work for COVID-19, for a COVID-19 specific purpose? Well, imagine you have Bob and Karen. If Bob and Karen's apps are both using location services, that both phones are turned on for location services, it would record that they have both been in a coffee shop. If Karen later tests positive for COVID-19, her trail would be used to her contact tracer, would use her trail to notify others, including Bob, who would have been sitting in a coffee shop with Karen the day before. Bob would receive an alert on his phone. That seems relatively straightforward. In the context of Bluetooth, there is a reasonably similar technology. I won't have time to describe in great detail how Bluetooth works, but essentially for those who are familiar, Bluetooth activated on a cell phone, a smartphone, a laptop, a printer, or a keyboard enables you to execute transactions, we could call them, between machines without the fuss of wires, right? So Bluetooth headsets, for example, transmit calls from your phone to your headset that might be plugged into your ear without you having to dig into your pocket for your phone or your backpack or your handbag, right? What you should know about Bluetooth transmission is that every device has its own address, a unique 48-bit identifier with six bits of information that essentially look like a code. I'll give you an example. 01, semicolon, 23, semicolon, 43, semicolon, 67, semicolon, 86.10. Wow, what's all that? The first 3 bytes are assigned from a specific manufacturer for a particular device. The last 3 bytes are assigned by the manufacturer. What does all this mean? Well, if Jack and Jill are seated near each other for at least 5 minutes, the contact tracing app on their phones might exchange anonymous codes via Bluetooth. If Jack later tests positive for COVID-19, his code stored on Jill's phone could be used to alert her. Someone near you tested positive for COVID-19. This seems like an amazing supplement to the labor-intensive manual contact tracing processes that have been used historically to facilitate tracking disease. However, there are grave concerns that I'll describe quickly now and explore in greater detail in Q&A as you might signal that you have interest. So in the first instance, I've described the notion that it's smartphones that will enable individuals to download apps. Looking at the data, and anecdotal as well as empirical data, there is cause for concern. In San Francisco, for example, some of the biggest case clusters in the city are around the city's homeless population, which are very unlikely to have smartphones. In other instances, certain populations that are extremely vulnerable, such as populations of advanced age, might be the group that is also less likely to have adopted smartphone technology or adapted to the use of something like a COVID-19 contact tracing app. In addition, there are some challenges around specific communities that give rise for grave concerns. For example, one health official in San Francisco said that fear of immigration authorities is discouraging certain groups, monolingual Spanish speakers who live in crowded multi-generational households and may not have immigration documentation. These groups might be discouraged from participating in citywide manual tracing apps. In some instances, we're deeply concerned because the use of these apps might lead to leaking of data from the phones of the individuals who have signed up for the app. All of this begs the question of whether or not we will have sufficient participation for the apps to be useful at all, right? So to a certain extent, researchers have noted that unless at least 40% at a minimum, but perhaps we would need as much as 60 to 75% of the population to sign on to an app in order for the app to have the kind of success that we might hope for. People are deeply confused about the ways that these technologies work, and in fact, they presume that merely downloading the app itself will serve as a panacea. The research technologist who created one of the first contact tracing apps has expressly declared that there is no automation. There have to be humans in the loop. The humans are in fact necessary to play detective. If you might shift to the next slide, slide 6. Technology is not a panacea for many reasons. And one of the reasons technology is not a panacea is because we've not yet effectively trained machines to do what human brains might struggle to do themselves. So you'll see in the slide that is presented just before you, research that Max Wolf published. It's an open source code generation of visualization. And the goal behind his publication of this open source generation of visualization is to prompt us to think carefully about the extent to which we can genuinely train machines to see things that our human minds might struggle to sort out as well. The creator of one of the apps, COVID-19 contact tracing apps, has described the necessity to continue to rely directly on humans to prevent and address a number of questions that the technology will not be successful in overcoming, including false positives and false negatives. A number of shortcomings of the technology were apparent well before we attempted to use artificial intelligence in the context of COVID-19 contact tracing apps. In light of the limitations of the technology, it's worth noting that we should be continuing to plan to work collaboratively together, right? Leaning on public health officials to give guidance and direction. But we should also be somewhat suspicious about the likelihood that an app, even the app that's the joint initiative of Apple and Google, might lead us to the place, lead us to the space that really overcomes the concerns that we're thoughtful about. I'll say just one or two more things about concerns that grow out of the use of artificial intelligence broadly and the contact tracing apps generally, and then open the floor for questions. So really quickly, in the context of the use of contact tracing apps, a number of media articles and anecdotes have increasingly highlighted concerns regarding privacy, as well as policing in the context of COVID-19 tracing apps. Next slide, please. In the context of privacy concerns, what we're thoughtful about is, for example, the use of the methodologies that have been adopted by some of those who are creating contact tracing apps signals the potential that those apps could be adapted for other purposes. I mentioned earlier, for example, concerns around the concerns of the undocumented immigrant community and the potential for these GPS tracking apps to be used by ICE for purposes of identifying and targeting that community. We're also deeply thoughtful about the potential that employers or private entities that have created their own apps may not have sufficient cybersecurity protections to prevent the data from those who adopted those apps from being leaked or stolen. We're also deeply thoughtful about the extent to which artificial intelligence more broadly has created grave privacy concerns. Legal scholars, including Julie Cohen at Georgetown, Frank Pasquale at Maryland, and social scientists like Kathy O'Neill and Virginia Eubanks, among others, have strongly encouraged recognition of the limitations of AI and the potential that artificial intelligence has integrated certain biases, and that those biases might be reflected both in the inputs and outputs of these platforms. And by way of example, very specifically, the Vera Institute and the ACLU, both participating in the conference that Dean Meyer mentioned earlier, highlighted the potential for bias in risk assessments of artificial intelligence platforms that were used to determine bail for those who had been arrested, as well as sentencing assessments for those who had been convicted. So there are a number of examples across society of the limitations of AI, and now we're integrating this platform, at least in the public-private context or partnerships, in a way that may possibly expose more citizens to breaches in their privacy or even more concerning outcomes. Last slide, please. As a final word, I just highlight that we've seen some emerging social justice concerns that prompt us to become increasingly concerned about the response to COVID-19, including reports that in the earliest days of social distancing policing in New York City, the city issued summonses, for example, over a period from March 16th to May 5th, 374 summonses, 304 were handed out to Black or Hispanic persons. A number of social scientists and commentators and activists have commented that the use of the social distancing policing procedures has come to resemble the stop and frisk policies that had been adopted and widely decried in New York City years ago. There are concerns that the gathering of protesters in certain contexts has not resulted in police action or activity, whereas in the context of policing individuals in certain over-policed communities has resulted in not just summonses, but in some instances, jail. So there are great concerns around how we will effectuate policing in these contexts, and the creation of a COVID-19 contact tracing app triggers the potential for misuse or abuse in this context as well. I'll pause there because I'm very eager to hear your questions, and I'm hopeful that if you might share them in the chat, that Jenny will present them and we can begin to develop responses both to the integration of the technology and privacy and social justice concerns together.
Thank you so much, Professor Johnson. That was just terrific. And you do have a lot of questions in the chat, so I will try to get to as many of them as possible. Back toward the beginning, when you were talking about, I think, AI and tracing, there was a question about where is the information stored, for how long, are there HIPAA questions, and then it says assembly surveillance issues, question mark.
I love it. All of that resonates with me, even without more. In the first instance, yes, we've had as a nation a number of questions emerge about the use of artificial intelligence and the collection of data in the context of medical privacy rights. And so a number of my colleagues, Frank Pasquale among them, has regularly written about concerns regarding the aggregation and collection of this information and violation of HIPAA. At this point, what I can share is that there are congressional efforts afoot to introduce a privacy bill that is intended to protect against these types of concerns. But in truth, from the public health perspective, gathering the information is a compelling state interest that would likely lead to justification for the contact tracing policies generally. The assumption that is embedded in the privacy bill, and that is deeply part of the Apple-Google public-private initiative, partnership, is to ensure that the data is anonymized. Now, this actually is a valuable strategy in a number of contexts that is used for purposes of creating the sizable volume of data that is regularly used for purposes of training machine learning algorithms. However, I, among many others, have regularly signaled that it is complicated to anonymize data and that a number of hackers have essentially, in fact, I'm very thoughtful about, in particular, a group at Stanford that essentially took anonymized data and reverse engineered information about the data to identify the individuals that were the sources of that data, right? So I offer this up as briefly as I can at the 30,000 foot level to simply suggest that even the promise of anonymized data or promises to shield the identity of COVID-19 persons is a real concern. And we don't have immediate, in my humble opinion, we don't have immediate and effective answers to those questions.
So similarly, there's privacy. This questioner asks, can the government require the use of a contact tracing app? If not required for all, is there still a benefit? For example, if it is only used by people who opt in, would it cover infections from persons who did not opt in? And if so, what is the use?
This is a great question. I'm going to work backwards. First, what we know for sure about learning algorithms in general is that the volume of data necessary for them to be effective is often significant. So very significant volumes of data necessary to train machine learning algorithms. But also in this context, and I described earlier, that if we're presuming a voluntary, that term opt-in presumes that you're voluntarily participating. If we are presuming voluntary participation at the outset, it immediately excludes everyone who does not volunteer, right? So we have a challenge at the outset in terms of structuring the policy in a way that will actually be consistent with our public health concerns. So if the policy is structured as voluntary and, as you describe or the person describes in their question, too few people opt in, then absolutely right. There will be too little information for the policy to be effective. With respect to mandatory requirements, so I can think of several countries that have already began to introduce tracing apps. Singapore, Taiwan, Singapore has introduced, India has introduced, a number of other countries are increasingly introducing, China has introduced in certain contexts, tracing apps that are not voluntary, they are mandatory. Now, in the context of the mandatory apps, there are a variety of challenges. First, at the privacy level, we have all the concerns that I articulated earlier. But actually, even more so concerning is sort of policing with respect to the use of that information, right? What types of obligations are put upon those who are identified as COVID-19 positive? Are they not allowed to go out to work? Are they limited in their interaction with others? How do those limitations play out, and who polices those limitations? And are there certain areas of our city and populations that are more likely to be heavily policed? That's sort of putting all the pieces of my talk together. I would also add, however, with respect to our national framework, that we have other dilemmas. We do not have a national health institute or agency that could impose a mandatory national adoption of COVID-19 tracing apps. The questions of health and human services on these issues are often left to the states. And in some instances, even cities have taken different approaches, right? So we could have a disparate response by a city mayor versus a state governor, and there is no federal agency to force uniformity among these issues. There is potential for the FTC and the Department of Health and Human Services to engage, but this type of local identification, infectious disease identification and policing is not something that we have ever had mobilized on a national level. And it's not clear which federal agency would necessarily have authority or capacity to execute that kind of a mandate.
So this is an interesting question to a complicated subject, obviously. Is there a discussion about forcing people to download the apps to say, for example, to enter a university or a business?
So this is a really curious question that we don't have an answer to yet. I think we will certainly see in the coming months that private institutions, they could be universities, they could be employers, might require employees or students in the context of a university and faculty and staff to download such an app. PricewaterhouseCoopers, I believe, is one private business that has already announced its intent. I don't know if it's in the US specifically or in other jurisdictions, because this is a multinational corporation, and in different jurisdictions there is already positive reception to the use of this type of a mandatory contact tracing app. So I could imagine whether it's PricewaterhouseCoopers or another multinational corporation operating in a certain jurisdiction where the government has already approved use of that type of a mandatory contact tracing app, employees would be then required to download that app, and that app would report out to the employer, probably in the weakest form, not only in terms of privacy protections, it would not only broadcast to the employer where the employee was during the course of his or her workday, but it might also broadcast beyond. In other words, it might become a tool for surveillance of the worker in the workplace and then beyond, right? All of which is gravely concerning.
Right. And I know you touched on this, and we didn't give you near enough time, but there are some questions about, social justice concerns. Can AI be trained to mitigate prejudice? And how do you encourage adoption if there are people who mistrust such organizations or mistrust people that might be knowing their whereabouts?
Yeah, so this is, one of the main challenges is as a country, we don't have laws, we don't have a history of developing and adopting laws that are designed expressly to address this kind of concern, right? In other countries, there might be a culture of government intervention at a level and in a form that would be unacceptable here. And the absence of that culture is likely to prompt us to demand greater protection of privacy, right? So in part, the current bill that's being debated in Congress, or at least being proposed now, is motivated by the reality that culturally we expect certain privacy protections, right? We expect certain privacy protections. I'm not sure that we will be able to answer all of those questions in the context of a public health emergency, because it is such a unique set of circumstances that prompts this demand. And the public health officials who have regularly used contact tracing at local levels to deal with a variety of infectious diseases do in fact believe in this approach and believe that it could be a life-saving strategy. The challenge is that, on the other hand, the technology, once adopted, can be adapted for many purposes. And some of those purposes might be to commercialize the information and to use it as a mechanism to target particular audiences for ads, right? We've seen that in the ad targeting context, but it could also be used for more concerning purposes, particularly in the hands of government. So if in the hands of employers, there are certain concerns. If in the hands of government, there are other concerns. As I mentioned earlier, the targeting of undocumented immigrants by a federal enforcement agency that is looking to identify them and track their whereabouts. But also, we've seen, even in New Orleans, Palantir had partnered, at least we understand it to be the case, that they had partnered at some point with city government here in New Orleans, and their surveillance apps were being used to track individuals for purposes of, at least the project suggested, identifying those engaged in gang-related activity. So certainly the theory of the project seems something consistent with law enforcement. The execution, however, seemed to trample rights, and the ACLU has investigated this sort of very carefully for the purposes of identifying violations of the rights of the individuals who were accused or for whom cases were brought based on information obtained through that surveillance. So there are lots of tricky corners in this context, notwithstanding the great public health concern that motivates the adoption of the apps.
There are several questions about whether an employer can mandate that their employee download one of these apps.
So in the current moment, there is definitely not federal regulation that would prevent an employer from making such a request. The extent to which the request is consistent with the employee's rights, however, I actually would defer to one of my colleagues who's at Cornell, Ifeoma Njua, who has written a really great paper that was published in the California Law Review a couple of years ago in collaboration with a group in New York at NYU that sort of expressly examines this question of worker surveillance, essentially. And there are a number of different types of artificial intelligence that have been introduced to surveil workers. I think most of you might be familiar with Amazon's use of surveilling workers in its warehouse. There are a number of other contexts in which we've seen tracking of employees or workers. State trucking, Karen Levy's work on those who engage in interstate trucking is another example. I think what's been difficult is we've not seen it sort of touch down in the average, I would describe it as white collar office in the United States. So we haven't had nearly the kind of or volume of reaction that we're likely to have in this context, where employers are possibly determined with reopening the economy and maximizing production by having as many employees available to work as possible, but noting that they must ensure the health and safety of the workers who are coming to work, right? And so their proposal is, one of the ways you can do it is through testing. There aren't nearly enough tests for the volume of testing I described earlier, 5 million to 20 million tests possibly in a single day. There's not production for that or evidence that exists. There are no vaccines or known treatments. And so at this point in time, if testing is failing us and returning to tracking and tracing, and then even more possibly disconcerting, we're relying on private employers to adopt a technology that effectively enables tracking and tracing and limits that tracking and tracing solely to employees' hours at work. And even then, there's a lot of creepiness involved in that, right? I went to the bathroom for 5 minutes. Why were you in the bathroom for 5 minutes? I went 3 times to the bathroom. If you're a woman of childbearing age and you're in the bathroom because you're ill while pregnant, like I was, maybe you don't want your employer to have a perfect record of every instance in which you felt ill and had to go to the bathroom to sort of gather yourself, or possibly to become well enough to continue working. There are lots of reasons why this is exceptionally creepy, but now we're going to be forced to really weigh those issues of privacy against sort of the demand for public health or protection of public health.
By the way, I should have said from the beginning, Professor, that there are so many positive feedback. There's so much positive feedback on the chat. I'm having to scroll through to get to the questions because
it's really okay.
So impressed with your knowledge here. One of the questions actually that came in later in the chat, but it seems to be a little bit different and interesting, is how would you apply some of this thinking to minors? And
so I saw that question. Yeah, I saw that question pop up. I think this is a great question for several reasons. First, we're starting only now to begin to explore the implications of artificial intelligence in the primary, grammar, and upper level school years, right? So we've had some tracking taking place of those who might be university age or basically have reached an age of majority and may still be continuing education. But those who are minors and who are relying on basically public school systems have increasingly been subject to a variety of artificial intelligence platforms. Some of them obviously innocuous, if not positive, for the purposes of improving scholastic performance. We would love to see an improvement in the children who are enrolled in public schools and private schools around the country. And we are thoughtful about the ways artificial intelligence can help us identify the strengths and weaknesses of their capabilities in math or science or reading. But also these artificial intelligence technologies are used in ways that are not solely about academic performance. And this question is so timely because we had already had a number of inquiries about concerns in terms of the use of tracking and surveillance of particular populations of students that might have had disciplinary issues or other concerns. This opens the door for the use of surveillance of minors, children essentially, in schools and beyond, in a way that we have historically been very cautious about the exposure of children, essentially. One of my colleagues, Najarian Peters, has written extensively on this question of privacy in schools. I think that it's a really interesting and interesting topic for which I don't have nearly enough answers. There are unresolved questions here that I think really demand our attention. And I'm hopeful that some of you are thoughtful and possibly scholars writing and researching in this area. The children's privacy questions are very critical questions, and they are underexplored questions. So I thank you for that question. I'm deeply concerned. I don't have nearly enough answers.
well, and there are so many wonderful questions. We will save the chat and try to get back to people for the questions we missed. I do want to make sure that Dave Meyer gets the last word here. This has been fascinating. I'm sure the school is doing a lot in COVID-19. So I wanted to turn it back over to Dave for some last comments.
I'll just say congratulations to Kristin, and every time I have the opportunity to hear her speak about her work, I learn so much, and I think everyone surely appreciates why we are so proud and delighted to have Kristin at Tulane. And she is a leading light to, along with many other colleagues who are working on various dimensions of the crisis. So thanks and congratulations, Kristin.
Thanks so much.
Well, thanks to everyone for joining us. We have really had a wonderful webinar series here, and are looking forward to our next edition on Monday, May 18th at 11 a.m. Central Time. Will be our next plug-in webinar featuring Tulane Innovation, the race for COVID-19 treatments, tests, and a vaccine. This will feature Kimberly Foster, Dean of the School of Science and Engineering, Bob Gary, and Skip Bohm. So you can sign up at alumni.tulane.edu/plugin. Thanks to all for joining us. Thank you so much to both Dean Meyer and Professor Johnson, and hope everyone has a great day.
Thanks so much. Bye. Thanks.